Right, so yes, my name's Christina Davies. I'm Director of the Centre for Arts, Mental Health and Wellbeing at UWA and Chief Investigator on Good Arts, Good Mental Health. Yes, I am an artist, I'm a painter, but I also have a graduate master's and PhD in public health. So I'm an epidemiologist and a health promoter, and I have worked at the health department in terms of being a policy officer and a senior evaluation officer, and I also consult as an evaluation officer. And so all of these, I guess, experiences, but also the fact that I am an artist have impacted Good Arts, Good Mental Health. So today I am going to be talking about Good Arts, Good Mental Health from idea to Arts Mental Health campaign. How did we do it? And was the campaign successful? All right, so the format is I'm going to talk about the idea and the research that we had to do. Then what is Good Arts, Good Mental Health? So the campaign, how did we co-design it and deliver it? And then finally, the evaluation results, so the method and the results, and then questions. So how did this all start? So, how did we get the funding? What was the proof of concept? How did we do this? So the fact is that we have a global mental health crisis. This then translates to the national and the local level. And there are lots of solutions that, especially in health, that they use that are evidence-based. Most of them, though, focus on things like physical activity, sport, nutrition, sleep. And these are directed at the general population and also specific target groups. So anyone who's heard me talk before will have seen this slide. These are all the campaign messages and messages for sport. For those of you who remember it, the green circle on the right is Life Be In It. So Norm is actually 50 years old this year. And so for 50 years, basically Australians have been told sport is fun and sport is good for your health. But the thing is, where's the message saying art is fun and art is good for your health? This is just something that's missing. Now, during COVID, we had, of course, Think Mental Health, which was be positive, be connected, be active. And then later on, 3 more circles were added and arts was added to hobbies. And yet, what is the thing that most people did during COVID? They did their arts. But this wasn't as there's a full circle there for physical activity and for sport. But at the moment, until Good Arts, Good Mental Health, this idea of the arts as a health message was missing. So the problem, like I said, was the mental health crisis. So we have these solutions, yet we still have a mental health crisis and it's getting worse. So what does this mean? Well, what this means is that we need new ideas. They need to be innovative. We need to consider individual differences, budgets, lifestyles. They, of course, need to be evidence-based. And given that I'm an epidemiologist, I like doing things at a population level. But also, when it comes to, I guess, all of this research, Good Arts, Good Mental Health isn't something that just kind of started a couple of years ago. Good Arts, Good Mental Health very much has been 25 years in the making, whether it be arts and health research, the evaluation that was needed, a full PhD to be able to get it going. Because as an artist, if you work in the arts, you kind of see it. You know that recreational arts has an impact on mental health, on community mental health. But the thing is that isn't what happens in health. In health, you have to follow health protocols. There are hierarchies of evidence, grade systems, and so forth. And so for me, as an epidemiologist, I knew that this couldn't just be an artist saying arts impacts mental health. We had to follow health protocols. We had to show the evidence the way a health person would show it. Now, like I said, 25 years worth of research, but there were 4 main things. And these 4 things I think are also useful when it comes to applying for grants and also then extending the scope of who you're applying to. Because, every local government now has a public health plan. And not in terms of local government, artists can apply for not only the arts relevant grants, but if you're looking in terms of public health, in terms of mental health, we could be also applying to the mental health and the public health grants as well. So the 4 things that were important here was a definition of arts, knowing what the outcomes are, a systematic review of the evidence, but also knowing what the arts mental health dose was. Now, why is this important in terms of health? So in health, when it comes to campaigns, we don't just say to people, go and do physical activity, or we don't just say, eat your fruit and vegetables. We say, go and do 30 minutes of physical activity per day. So we're not only telling people the activity, we're telling people how much to do. Or we go and say, go and eat 2 fruit and 5 veg. Why? Because you want people to be eating 2 and 5. So we're telling them the dose, we're telling them how much. All right, so starting off first. So first of all, we defined recreational arts engagement. Now, I know in terms of the arts, we have like, I guess, a big view of the arts, but usually when we're talking in terms of health, what we need is like an activity-based definition. So in terms of defining arts engagement for population-based research, we went to 200 experts in the field of arts and health. And what they told us was that arts was active and receptive. One isn't better than the other. They're just different. So active, you might be making and creating. Receptive, you might be viewing, attending, listening, visiting, reading, watching. But the thing is that, say, with active, I think everyone acknowledges the impact active arts engagement can have, but receptive can as well. So if you think about receptive engagement, say if you go to a concert, you're probably going to have lunch or dinner with someone first, then you're going to go to the concert. Then whether the concert is good or bad, you're going to talk about it afterwards. So there'll be a whole social media part of that, or chatting to friends, or whatever it is. And so it's not that active and receptive, one's better than the other. They're actually just different. And that's how we should acknowledge it, and that's how we should explain it. Then within the arts, you've got the performing arts, visual arts, design and craft, literature, online, digital and electronic arts, community and cultural festivals, fairs and events, and all the variety of activities within that and collaborating between it as well. And I guess the definition is important in terms of explaining to various groups or cross-sector what it is that we're doing, but also for replication purposes, if we are doing evaluations, it becomes important. And this definition, of course, is used by the World Health Organization. Now, the second step we did was we looked at what are the arts and health outcomes. Now, this wasn't theoretically sitting there and, doing, I guess, desktop research. This was actually going out to the general population and asking people, what do you get when you engage in the arts? And they said to us that they had mental health outcomes, social health, physical health, economic, art-specific identity and knowledge outcomes. But what was super interesting was that mental health outcomes were mentioned 7 times more frequently than any other outcome. And when they mentioned mental health outcomes, they were mentioning mental well-being. So they were saying happiness, joy, enjoyment, relaxation. For them, the word that they mentioned the most frequently was happy. And that is interesting because, say, as academics, say, as artists, we very rarely pitch this word happy and arts, but actually the community, happy is their word when it comes to arts. We also conducted a systematic review in the health method. And what we found was that there was actually a relationship, a strong evidence-based relationship between arts and mental well-being. And then we calculated the arts dose. So first of all, we found a relationship between arts and mental health. And then we found a threshold at 2 or more hours per week. And this was after controlling for a range of confounders and effect modifiers, being sex, age group, location, income, education, marital status, children, general health, sports engagement, religious activities, and holidays. Now, what does that all mean? What that means is that if you say, I do art and it affects my mental health, well, a sports person could come back to you and say, oh, yeah, but you also do sports. So how do you know it's not the sport that's impacting your mental health? Well, or, they might say, oh, well, maybe this person is healthier than that person, or maybe you've got more money and that's what's impacting your mental health. Well, what we did was statistically, we took all of those things into account. And even after accounting for those things, the arts mental health relationship stood up, and people who engaged in 2 or more hours of arts per week had better mental health than those people who did less than the 2 hours per week or who did no art at all. So statistically, we were able to show the dose and the relationship. Now, also, why take a general population view? And now both of these are important. So you kind of, I guess, need to have the people who are doing the population media campaigns and promoting a message so that the general population understands it. And then we also need these targeted strategies to specific groups to improve mental health. And, and why do this? So with that top graph, if you imagine that that's the general population, say if we were to focus on older adults, what we're doing is we're impacting the red bit. And by improving mental health, say in older adults, so we're trying to change their attitudes in a big way, their intentions, their behaviours. And by doing that, what we're doing is we're affecting the steepness of the curve. But when we have a message like good arts, good mental health that goes out to the whole population, what we're doing is we're going from, so now we're looking at the bottom curves, we're looking at the blue curve and we're shifting everyone to the red curve. So we're changing everyone's knowledge and attitudes and intentions and behaviours just a tiny bit. But in changing everyone just a tiny bit, we're reducing their risk of mental ill health. And what that does is, so where those two graphs cross, so where you've got the red graph and where you've got the blue graph, and you've got that little bit that's bluey red in the middle where you've got the green arrow, that's millions of people. So basically, we're impacting millions of people just a little bit and getting them to maybe think about doing some arts for their mental health. They're totally cost effective, totally worth doing. All right, so what is good arts, good mental health? What did we do and what is this campaign? So good arts, good mental health. So I'm focusing on the health promotion campaign today, purely because of time. But we also ran demonstration programs, also learning opportunities, also demonstration programs with arts narratives. So thanks, Brad, that was fantastic. And one of the points, that I want to make, because we focused on a health perspective in terms of the proof of concept here, we were actually mostly funded by the health department through the Future Health Research Innovation Fund. We also had funding from philanthropy, DLGSC, arts and health industry, but the majority of the money actually came from the health department for good arts, good mental health. So the campaign ran from August to September last year. It was statewide, so 2.9 million people across the state of Western Australia, which is 2.6 million square kilometres. This was innovative. It was a world first, trademark, population level arts mental health campaign. The target group was WA adults 18 to 65. And the reason that this was the target was because when it comes to WA adults, that's what the dose is calculated for. So we stuck to what the dose was. And also when it comes to budget, so we had $198,965, which sounds like a lot of money in the arts, but keep in mind that other campaigns, so other health campaigns usually have about $1.5 million. So ours is teeny weeny tiny compared to what a normal health campaign has. So co-design. So what we wanted to do was, even though we had this background research, so we knew the dose, we knew what the outcomes were, we had a systematic review, but when it came to actually then running good arts, good mental health, we wanted to ask people, so through surveys, focus groups, interviews, we wanted to ask people, what words should we be using? What images, what language should we, is there something we should do, something we shouldn't do? So we actually talked to actually I've got the exact number. So we talked to 3,560 West Australians about how we should do good arts, good mental health, what we should call it, how we should deliver it. Also our funding partners, so the Ian Potter Foundation, Minderoo Foundation, Future Health Research Innovation Fund, Department of Local Government, Sport and Cultural Industries, Circuit West and St John of God Healthcare. The team was from 7 universities, 31 project partners. We had a community and consumer reference group and also the government mentor group, which was the health department, Mental Health Commission and also DLGSC, and they met with us quarterly. So now the co-design method. So this was the surveys, the focus groups, the interviews. Now I'm going to say I'm so glad that we did this rather than just having research and going ahead and thinking we knew what we were doing. I'm so glad that we actually we did the co-design with the target group. And I'm going to say to everyone, don't assume. It's really important that you do your research with the target group to make sure you are delivering what they want. And so you might find some of this interesting. And this is, relevant, I guess, in terms of promoting your own program. So in terms of what did the general population want when it came to good arts, good mental health? So in terms of images, and like I said, this is relevant for advertising, programs or advertising things that you might be doing, events, say, for example. For images, they wanted to see everyday people. They didn't want to see arty people. They didn't want to see health people, and they didn't want to focus on children. They also wanted to see the range of arts options that they could undertake, because for them, they didn't really know what art was. And they also, the budget was important. They wanted to see low cost, no cost options. And they also wanted to see art in everyday environments. So, you know, what art could they do at home, at work, on their way to work, school, in a park, at the beach? They wanted that range. Also, they had preferred wording. They wanted invitational wording. So try as compared to telling them what to do. Start. Also, they wanted encouraging wording. So you don't have to be good at arts for the arts to be good for you. They also preferred the word arts over creativity. So for the general population, creativity means making, and not everyone wants to make. Also, arts versus culture. Now, this one they thought was a bit confusing, because to them, culture also meant sport, it meant language, it meant a whole range of other things. And they basically said, if you want me to do arts, say arts. So we said arts. And they also wanted positive words. So they wanted to hear mental well-being, good mental health, happiness, joy, relaxation. They did not want to hear words like depression, anxiety, or stress. And also when it came to the dose, they wanted to hear 2 hours per week versus 20 minutes a day. Now, this to me was, I thought 20 minutes a day. Like, so I actually thought when we first started this all, and I'm just going to flip back because you'll see there that also for preferred wording, they said, don't tell me what to do, don't say start. This is important because when we first started all of this, I thought our message was going to be start 20. So if we had done this and we hadn't done a co-design, we'd have got it 100% wrong. But this is why you should co-design things with your target group. So they didn't want to hear 20 minutes a day. They wanted 2 hours per week because they wanted to decide how to do it. So some people wanted to do 20 minutes of reading before bed. Someone else wanted to go to the theatre on Monday. They wanted singing lessons on a Tuesday and, I don't know, pottery on a Friday. Whereas someone else wanted to do 2 hours per week straight up. With friends, going to see a concert, whatever it was, they were like, give me the information and I will empower me and I will decide how to do this. But it was important to mention the dose because if you look at annual stats, actually our annual stats for arts engagement appear to be quite high. But the thing is that we're engaging at levels that are insufficient to achieve a mental health benefit. So what does that mean? So if you imagine, if you have a headache, and if the idea is you take 2 Panadol for your headache, well, imagine if you only took half of Panadol, then you're not going to get rid of your headache. So that's the same with arts. We need to be helping people. We need to tell people, what the arts dose is, and then giving them the information about what art is, and then giving them those options in terms of what to do. So with all of that then in mind, the aim for the campaign was to increase community awareness, comprehension and agreement with the idea that arts could impact mental health. We also wanted to say to the community, we wanted to increase their intentions to engage in the arts for better mental wellbeing. And we absolutely said as much as we could, you don't have to be good at arts for the arts to be good for you. Now, this is major, whether it be promoting an event, where you are, or a program or whatever it is. A lot of people don't engage because they actually think that they need to be good at it. They need to have a certain skill level. So this is a major barrier to engagement that we really need to overcome. So the tagline for the campaign was good arts, good mental health. The catch cry was you don't have to be good at arts for the arts to be good for you. We rolled it out in the methods that the community recommended, which was radio, Spotify, social media, editorials, free and organic media. So we had the social media that we paid for, but then we also had the free and the organic media that we didn't. So free media, things like, say, you might put out a media release, do the interviews, you might through your own social media be sending things out. We also had the campaign website, campaign merchandise, and event signage and posters. So the campaign website, that is up. The main sections that I think people really liked was the learning section. So you can do a free short course to find out more about arts and health. People also looked at the research, so the papers, you can download them or you can just read them online. And they also really loved the campaign section, the news section, and the youth section in terms of the 5-day challenge. So if you have people where they're just like, oh, I'm not arty, I don't know where to start. Yeah, it might be good for my mental health. There's a 5-day challenge, which basically for 5 days leads them through. So day 1 is listening to your favorite music. Day 2, I think it's colouring in. Day 3 is photography. Day 4 is origami. Day 5 is reading. And for each of those things, you know, if you don't have colouring in sheets, we've got colouring in sheets you can download. If you don't know what to do for origami, we've got a boat that you can do. We've made it as easy as possible to be able to do the 5-day challenge. And like I said, we've also got all the resources online. So if you want to download colouring in sheets, you can. If you don't know where to start for happy songs, there's a Spotify playlist. We've even got a library finder to find your local library if that's, you know, what you need as well. So everything is on the website, and everything on the website is free. Also, then when it came to radio and Spotify, so for radio and Spotify, the ad was music, reading, painting, dance, whatever arts makes you feel good. You don't have to be good at arts for the arts to be good for you. Try for 2 hours per week. It could make a difference to your mental health. Good arts, good mental health. Now, for Spotify, this played for free Spotify. So, of course, you'd listen to your music, then the ad would pop up. And if you wanted to, it had a learn more button that would jump you to the website. On radio, and because we for Metro we had Nova, which meant that we also got Coles radio as well, so we were also played in Coles, but for radio it was Metro and regional, and I think it was about 13 radio stations. And look, it went great. So not only did we have the ads, also then the talent on the stations also ran their own games and challenges and did their live reads and their social media posts. And we were very lucky during the week that we were with Nova. Alvo visited, so the Honourable Anthony Albanese, and he was a very good sport and participated in a drawing challenge. And so that is his dog Toto. So we're very happy with that. Also, we had the campaign merchandise. All of it was arts related. So everything from eco bags through to colouring in pencils, colouring in sheets and so forth. We had the poster to make it obvious to people, everyday activities that they could be doing. And also when it came to launching Good Arts, Good Mental Health. Now, a lot of people, when it comes to arts, we stick to arts events and venues, and I have no idea why we do this. We need to like get out to other places. And not only that, get out to other places where people aren't expecting you. So we launched Good Arts, Good Mental Health at the Western Derby. So Dockers and Eagles, there were 53,000 people at the stadium. And once per quarter, we lit up the stadium like a big rainbow, and it said Good Arts, Good Mental Health. And we also had a 10% share of voice as well of the scoreboard. So every 10 ads, it said Good Arts, Good Mental Health. And look, the results for this worked really well. And this was actually then how we got our TV advertising, because with 200,000, we just did not have the budget for TV. But by being at the Western Derby, it meant that we got West Australian, but then also national coverage as well. Okay, so the evaluation, how did this go? So we did our evaluation through a process evaluation. So we basically sourced online analytics and also a short-term outcomes evaluation through an online survey. And also this was done through West Coast Field Services. So we wanted the data to be collected by, you know, a different organisation. So, and that online survey was of the campaign target group. And we had ethics approval to do that. So the process evaluation. So for the campaign website, we launched the campaign website a month before the campaign ran, and we had 7,000 hits to the campaign website. Post the campaign, we had 53,000 hits to the website. Cost per reach was effective. It ranged from 0 for our free and organic media to 10 cents for radio. And the highest reach for the dollars that we spent was actually, so it wasn't just reach, it was also cost per reach, was actually delivered by Meta or social media, so Instagram and Facebook. So we reached almost 1 million people on a budget of about $18,000. And actually, and to the side there, you can see some of our tiles that we had in terms of social media. So the results, so these results, like I said, are way above expectations for the tiny budget that we had. But basically, our outcome evaluation showed that we managed to reach 24% of the general population in WA. And this is amazing for a new tagline, especially given that we had no TV advertising. Comprehension of the message was high at 49%. So did people understand what good arts, good mental health meant? Yes, so 49%. Agreement. So because this was the first time the message was run, we then said to people, good arts, good mental health means doing the arts that makes you feel good. So if you like to sing, sing. If you like to draw, draw. If you like to paint, paint. If you want to go to a concert, that's fine too. Do the arts that makes you feel good for better mental well-being. We, of course, had a big, long explanation, but you get the idea. Once we explained what good arts, good mental health was, we asked them whether they agreed with the message, and ready for this? 89% of people agreed with the message. 89% of people agreed that the arts they loved could impact their mental health. That, as a health promotion message, is a total winner and way higher than anything else that you would normally get in health promotion. And also, the intention to act on the message was 42%. Now, if you think if 42%, for 42% intention, that usually goes to about 10 to 12% behavioural action if it was sport. So if you imagine 10% of the population now doing more arts for their mental health, imagine how that changes participation in the arts across Western Australia. And so, like I said, agreement and intention to act, ours was 89% and 42% intention, and that is double what most West Australian campaigns actually get. Okay, so how did we achieve these results? Well, I think it was because it was guided by research, but then we also co-designed the campaign with with the community, with our partners. And I think when you design something with the community, it of course resonates with the community. There was also an amazing amount of goodwill, so from the community, from artists, arts organisations, even when it comes to our service providers, we basically got $90,000 worth of free radio ads because the message resonated. And with that as well, that message that resonates, we were also though asking people to have fun and do something that they enjoy. What makes them feel good? So again, I like to paint, so I would paint. If you like to sing, you should sing. If you like to sing and paint, do both. But if you hate both of those things, don't do that. Go and do your pottery. So that idea that it's not about getting everyone to sing, it's about getting everyone to do what they love doing. Also, we were showing people the mental health value of the arts. Now, this becomes important because quite often we're focused on just advertising participation. But here what we were doing, so things like messages like life be in it or be active or find 30, all of those messages, it's not just about the activity, you're actually telling people why they're doing the activity. And so in this case, we were promoting arts in terms of mental health. So it reduces then people feeling guilty for taking part in the arts. Or, like sport, we're telling people why they should make time for the arts. We also followed the 4 Ps of marketing, which are products, so arts for mental health, price, no cost, low cost, place. We promoted that you could do arts anywhere, anytime, at home, school, on the way to work, whatever it is. We gave people a range of options, and also it was well promoted. And also, like I said, this is a health promotion campaign. This isn't just a arts participation campaign. We were emphasising the product benefit, and the product benefit here was mental well-being, the mental wellbeing benefit of the arts. All right, well, that is good arts, good mental health, 25 years in a nutshell. The idea, the campaign, how we did it. Was the campaign successful? Yes. I was really hoping that I would have the paper for you. The proof has gone off, but unfortunately it isn't. It hasn't been put online yet. But it is open access. It is free, so you will be able to access that once it's actually published. Yeah. So questions.
Thank you, Christina. That's amazing.
Stop sharing.
Amazing. Yes, well, thank you so much for that. Yeah, open to questions. Anyone or any comment? Fiona, yes.
Thanks, Christina. Always like to hearing you talk. You've got so much enthusiasm and your smile is always
Hi,
so
Fiona.
infectious. I just wonder if you have a little cheat sheet for particularly things around the language to use. Have you got something like that? Or because I just thought that was quite nice to see emphasis on trying those sorts of things, just language to use.
Sure, no, we don't have a cheat sheet, so we should probably develop one. Because yeah, you're totally right. And I've got to admit, I have been thinking we should actually write up the co-design because, I've just mentioned images and the summary of images. My favorite one though, when it comes to images, was we presented, it was basically a dad and a child reading together, and we'd written, reading makes me less stressed. And the people were like, do you have children? Reading to a child, reading makes me less stressed. Can you please make sure that your picture matches your words? And then they were like, and why are you saying stressed? Reading the word stressed makes me feel stressed. Why aren't you saying relaxed? And, it's not obvious till it's obvious, but you're like, oh, yeah. And so now, our picture was actually a guy in a hammock, and it was reading makes me feel relaxed. But things aren't obvious till they're obvious is all I can say. But yeah, no, look, there's lots in terms of what images people are, and even that thing about they wanted to see everyday people in the pictures, not necessarily arty people or health people, because even the thing of should we be getting health people to be saying you should do more art for your mental health? Well, it turns out no, they wanted to see everyday people showing this could be easily done. So yeah, you're right, there's like more than just what I've presented in terms of from doing the co-design for promoting to the general population.
Yeah, I think so. Just like even at one page, just about the photos and images, I would find that really helpful. And then we could distribute that to other staff, and it's just an easy little guide.
Yeah, great idea.
Hi, can I ask, it's obviously been highly successful. Is there any plans or ability to maintain the campaign into the future?
Very good question. And at the moment, there hasn't been any, no, which I'm super surprised about. But I guess this is proof of concept, and this has been 25 years worth of advocacy. And I guess that question of why did I do it? So I know this is being recorded, so I won't say any names. But basically, this all started because I was evaluating for a health organization. So I'd gone to a sports event and I'd seen a sports message attached to that. And then I went to an arts event and the sports message was attached to that. And then I went to another arts event and the same sports message was attached to that. Now, one of those arts events was dance, the other event was theatre. So it made no sense. So basically, we were saying to people, sport is fun, sport's good for your health. And then I was going to these arts events and sport is fun, and arts is fun, but sport is good for your health. So it made to me no sense that we were at an arts event. Why can't we be advertising an arts message? And so, for what is the next step? Yes, we do need to find more money to run the campaign again, because the fact is that when it comes to health messages, a one-off event doesn't change people. It does need to be something that we say again and again. But also, I guess now in terms of the advocacy, we also need to be advocating for an arts message at an arts event, not a sports message at an arts event or outdated messages at arts events. So we do have a message that works. It doesn't necessarily need to be good arts, good mental health, but the time has come. And even, I just presented to the EU, so EU member states, the health ministers and the cultural ministers, and they're super interested in this idea as well of a campaign and promoting arts. But what I have said to them is that this does need to be what is evidence-based. And right now, in terms of the evidence, we can say arts and mental health. So yes, we do need another campaign. We do need another wave of the campaign. And for, what would we focus on? We need to be focusing on awareness. We do need to be focusing on the dose, but actually we need to be doing more in regional areas as well. So in the in the campaign results, there was a definite difference between metro areas and regional areas. So that's also a point of difference that we need to focus on. So not good news at the moment, no. So technically we would be ending in December because we don't have the extra funding to keep going.
And could you just explain what the difference between the regional and the metro was?
It was just in terms of awareness. So what we did was that for the results, we not only looked at was there, people, the percentage that were aware and weren't aware, but we also looked at it then in terms of age, gender and area. And in terms of awareness, there was a difference in terms of regional, but there was a difference in the budget that was spent. So even, little things like trying to get, say, posters up. If you're in the metro area, there's a distribution company that can put posters up for you. But for regional areas, we were pretty much relying on our friends. Even like, say, Circuit West, Circuit West, people who were there took away a bag with a whole heap of posters so that they could be put up in their local area. So we really, and this is why I guess I started the talk by thanking everyone, because I know like a lot of the faces that I can see on screen are a lot of the people that put up posters. So and helped us out when it came to, say, demonstration programs or proof of concept, which is what we've done now. Like Good Arts, Good Mental Health was very much a proof of concept because this hadn't been done before. It hadn't been done before in terms of running it as a statewide campaign, but it also hadn't been evaluated in terms of would it work. Because the fact is, we didn't know, would they be aware? Would they comprehend it? Would they agree with it? But the fact that West Australians agree with this message is huge. So if we are promoting good arts, good mental health, or even the idea that arts can impact mental health, we're already on a winner. So that starting point for, do they agree with it? Would they take this on board? Is it likely to lead to intentions, which will lead to behavioural actions? It's possible. Like that possibility is there. So so we do need to find the next lot of money to run it again, and I guess to keep it going. So yeah.
Christina, I think in one of our conversations you mentioned about getting funding from the health system. Arts organizations are all competing with all the little pocket of money for arts organizations. So in one of the conversations you mentioned that.
Yeah, look, absolutely. And it's also, so keeping in mind, I'm a researcher, not a marketing company. But in terms of proof of concept, we have shown it now for the general population, but the next step is young people now. Because Good Arts, Good Mental Health in terms of young people, like, I mentioned that in terms of the social media, so if it was 16 and above in terms of young people, there are so many avenues here where at a low cost, we could be promoting the arts for better mental health. There's so much that could be done, especially in that young people's space. So, in terms of how Good Arts, Good Mental Health will pivot moving forward, at the moment, it's, getting this paper out there, talking to people to let them know, but also if there is that interest in projects relating to young people, I think that's the way that we will be heading, that and also trying to find funding for a second wave of the campaign.
Christina, I'll just share something little that we did last year that's carried on this year with Wajo, the youth orchestra, and an Indigenous hip hop artist, Zero MC. Because it's been recorded, I can't say it's Clontarf Academy at the high school, so I didn't say that. And these kids last year, there was a little video made by the production for them, for everybody, and it's just showing Clontarf's very heavily sport-based as to getting these kids back on track, and along with a lot of other things. But they wrote a hip-hop song. They're actually down here 7 times this year, and they've already written 4 songs and recorded one. They're going to be playing in Perth with the orchestra in November. And just an adjunct to that, one of our stakeholder partners, Hollyoak and the Moorage Foundation, they're going to be designing shirts. So if they can't participate in the writing and the performing. There's always somewhere else, but it's the arts. And listening to these kids, just because they're not good at sport and they're not forced into it, but the peer pressure's well and truly there. They're adolescents and boys, the worst sort. So it's interesting to watch, and it's been quite eye-opening, but it's the arts that are getting them into this. And yeah, so I just sort of share that with you. There's more to it. There's going to be the kids playing music with them and all sorts of things, so from the high school band and stuff. So it's just giving some of these little organisations that are, say, sports focused in this case, or other organisations that might be focused in other areas, it's just showing them that the arts is good for them. And if you can hear these boys talk on the video, they express that music is their thing. It's not kicking a footy, although they still do, but it's music. And so yeah, it's just kind of nice to be enlightening them, I guess, via this project. And they're doing it. It's not us. They're doing it. So yeah, I just thought I'd share that with you.
And that that's wonderful. And that mix as well, I think, with sport and arts, that idea that it doesn't need to be one or the other. Like it's actually, and I guess that's why, when I started about taking into account individual differences and what people want, and empowering people so that they've got lots of different choices. And that's what Good Arts, Good Mental Health, I think, is doing, where there's this thing that people hadn't even considered, the arts they love doing, or even, when it came to the images, our poster is very much that Brady Bunch type picture with lots of people doing lots of stuff. That was because basically the general population was saying to us, we don't know what art is and what we should be doing. And when we started saying it's listening to your favorite music, it's reading books, it's going to your favorite concert, these are all things that they're doing that they're not aware of. And then they're not, so they feel guilty when they do it. But once you start saying, but this has a positive impact on your mental health, then that view of, oh, well, I should be doing it for my mental health, just like they view that 30 minutes of physical activity that they should be doing, they make time for it, it's prioritized. But also, something else that we need to be doing that I was talking about with the EU member states is finding the money for quantitative evaluation. Now, sport have been doing quantitative evaluation now, like they've got 100 years worth of research behind them. And so when it comes to these, oh, we've got a mental health problem, what's the evidence base? Oh, look, sport and physical activity, that's what we should be doing. Or, even in terms of being top of mind when it comes to health, we need to be making some adjustments here where we need to find a way to show that quantitative effect, the pre-post impact that mental health wise it has, which I think then it's just about collaboration. Because, and this is, so I'm definitely not saying that we all need to become evaluators. What I'm saying is that we need to collaborate more, because the same way that you couldn't say to me, Christina, we're going to put on a thing with football and music and we're going to make a video and whatever. If you said that to me, that would scare me. But if you had to say, and by the way, now we want to do a pre-post evaluation of the mental health impact that that's had on the group, no worries, I can do that bit. But it's about, I guess, working together to try to work out where to get the funding to be able to do that, so that we can then write these things up to actually have the proof, so that when, the systematic reviews are conducted, we've got the proof that this impacts health, which we have been talking about, Brad. So we will do that at some point.
So, Christina, you have presented at the European Union Parliament. Is there anything?
Well, it was so it's the European Union member states. So it's the health ministers, member states. Yeah. So it's the health ministers, the cultural ministers, their representatives. So that was very exciting. That was last week or the week before. So very exciting to present Good Arts, Good Mental Health. But also, really exciting, I think, for Western Australia that we've had a world first. But it's really the collaboration and just the help and the goodwill when it comes to the arts to make this happen, the advocacy opportunities, the even people that say weren't partners on the project helped. So this really has been a team effort across the state, which everyone should be really proud of, especially the results. I mean, 89% agreement that arts impacts mental health, or the arts you love impacts mental health, is really something that we should be, I don't know, yelling as soon as this paper comes out, that we should be advertising and trying to get more funding for, but also, at arts events, wanting and pushing for an arts message to be at an arts event. Like they would never put an arts message on a sports event. So why is there a sport or other type of message at an arts event? So yeah, we need to be promoting to the community. Well, I guess they wouldn't, but I did at the Western Derby. And I should say as well, when it comes to the Western Derby, football were totally happy to help us. So this isn't an us and them. I think that we should be learning from sport and learning from some of the things that they've done in terms of research and evaluation to make that value of the arts more visible. I think, everyone's in agreement. We can't rely on arts for art's sake anymore. That hasn't served us, or it did in the past. It's not going to serve us now. We have to be talking more about the value of the arts in terms of health. And right now we have the evidence for mental health.
Is there any chance of you presenting here with some of our politicians?
Oh yeah, I'm totally happy to. If you can get the politicians, no worries. I can totally present that again.
Yeah.
But I should say as well, and we do, once the paper's published, probably need to go back. We did, I guess it's good manners. We did, of course, do a brief to the arts and also the mental health minister before Good Arts, Good Mental Health was launched, and went to see the health minister and gave them a rundown. So once the results are published, then that's something that we need to do as well, go back and let people know the success of the campaign. But also that, there is an arts, so in terms of proof of concept, we can have an arts message promoting mental health.
Fantastic. Anyone else? Any last comment, question before we wrap up? No? All right. Well, thank you. Thank you so much, Christina. You have collected all the data, you have the proof now. We know that arts is good for mental health, but you just got us the data, the research, the hard work. This is fantastic. So yeah, thank you so much for your time.
Thank you for having me.
For the presentation. I know some of people here, and I know the hard work they do and the impact it has in their communities. As you say, they are just taking that banner with them and helping out there. So that's great to know that they have more supporters.
And also, on the campaign website, the papers, they're there for you to use. So like, say when it comes to the arts dose or arts outcomes, everything's there to click on it. It might be useful for a grant, but definitely in terms of talking to your local governments, like, don't just stick with, the arts grants or the community event type grants that are available. Now, I think we're relevant in terms of public health. The public health things that they need to meet, especially in terms of mental health.
That's great.
Great, thank you.
Well, thank you everyone, and thank you so much, Christina. We'll be in touch, and have a lovely afternoon.